All right, guys, welcome back. I hope you went and got a drink and kind of stretch your legs for a minute. Now we're going to get into the information here about home safety preparation. So setting up your home for your return before you have surgery will help keep you safe, make life so much easier, and aid in your recovery. Listed below are some suggestions for preparing your home for a safe recovery. Now, I want to tell you, before we go through some of these suggestions, probably the absolute best opportunity for you right now is to have a home safety evaluation done. Connect with an occupational therapist or a physical therapist who specifically specialize in home safety, home modifications, because these are the experts. I'm a physical therapist in the clinic all day long. I do not have the depth of knowledge and experience that a home modification expert does, and they can typically do a virtual visit with you. It's usually covered by insurance if you're going to be having surgery. And basically what happens is you use your phone or any kind of device. You take the therapist through your home. You go through the kitchen, the bathroom, the bedroom. You look at all the things, and they will provide concrete recommendations for you to help maximize safety, to help improve the experience you have after surgery and minimize the frustrations. You know, there's nothing worse than getting home from surgery with a total knee replacement, with your walker, with the pain meds and the grogginess and all of this. Get on the commode and then all of a sudden realize you can't get back up. These are the kinds of things that an OT or physical therapist who specialize in home assessments will be able to tell you about, so you don't get stuck in these compromised positions. So I'll share some resources at the bottom of this video so that you know where you can go to find information. And again, Medicare covers this service depending on if you go with a Medicare Advantage plan. We can check benefits and do things like that, but I would highly encourage you to connect with somebody who specializes in home assessments. They do not have to do it on site. They can do it through a virtual platform. But a couple of the recommendations from the Cleveland Clinic. So traffic patterns, right? Obviously move obstacles such as throw rugs, extension cords, footstools. You live in your house, you know where all the risks are, but you're so used to them, you don't even realize they're around anymore. If you have access to a rolling walker, a four-wheel walker, or a walker that has the wheels in the front and the skids in the back, use it right now, even though you don't need it. Take it around your home. See where you stumble, where you trip, where you run into issues, because that is probably, if you're having surgery here in the US, that's probably what you're going to be using after surgery. So check your doorways, the width, make sure you can get through, make sure you don't bang your knuckles. If you don't have a walker yet, try to get one before surgery. They will give you one at surgery, but if you can have one ahead of time and you can take it around the house, you will have a world of difference because you'll know exactly where the challenges are going to be. Looking at the bathroom, as I mentioned, ask an occupational therapist or a physical therapist how to adapt the bathroom to meet your needs during the recovery. They can do this through a telehealth platform. It doesn't have to be on site. You'll likely need an elevated toilet seat or a commode, a shower chair. We'll make recommendations. I've got a whole buyer's guide that I'm going to share with you on equipment that you need and equipment that you might want. There's certain things insurance will pay for, certain things insurance won't pay for. We'll talk about all that in a separate module. Sitting. So sit in chairs that make your knee lower than your hips. Choose a firm, straight back chair with armrest. A dining room chair may work. But I'm going to tell you right now, most of my clients find a recliner is most comfortable. There are going to be surgeon-specific guidelines. Some surgeons will tell you you're allowed to do this, you're not allowed to do that. You need to follow those guidelines. But most importantly, you need to figure out what's going to work for you. You have a very specific lifestyle, very specific house and furniture and all of these things. We want to tailor this advice specific to you. So while yes, it's important to have furniture that's comfortable, safe, easy to clean, The assumption is you're going to be coming home from the hospital probably the same day of surgery. You want to be able to clean surfaces and disinfect so that there's less chance of infection. Also, in case there's some seepage or some bleeding, you want something that you can clean back up so that once you're recovered, you don't have blood stains on your furniture. But these are all factors for you to consider ahead of time so that the day of surgery, when you're coming back home, you know exactly where you're going to go. You don't have to think about any of these things. Children and pets. So small children and pets can pose safety hazards. Small children may need to be taught how to interact with you to maintain your safety. If you have pets, make arrangements to keep the pets in another area of the house, or maybe somebody can watch your pets for a while. One of the most challenging things is having that small puppy, that dog that just loves you so much they cannot keep away from you for a day or two. And you, in all of your grogginess, the last thing you want to do is step on a tail, trip over a leg. So just think about some of these things. I mean, I'm a pet owner. I love my puppy. One of the best ways for me to manage pain is to have my dog next to me during those frustrating sleepless nights. I understand the benefits. I also, understand the benefits of being free of the responsibility. I don't have to worry about feeding and watering and cleaning up after my puppy. So you weigh the risks, you weigh the benefits, but have a plan in place. That's the most important thing. Have a strategy ready to go. Talking about stairs, I skipped access to items. To avoid reaching and bending, keep frequently used items within easy reach. Consider this as your pre-op programming and strategy. If you're going to have certain things that you use on a day-to-day basis, one of my favorite recommendations is start making a list today. Grab a piece of paper, have it near you, carry it around with you. The stuff that you use frequently, the lights that you need to turn on, the laptop or iPad that you're going to be working on, books, food, dishes, cups, coffee mugs. Get all that stuff within reach. So you're not using step stools, you're not bending over, you're not, in a low cupboard that you have to go all the way to the back to get to. That will make your life easier. You make a little note of all the stuff you need nearby. So when surgery day is here, all of that stuff is ready to go. I also recommend planning activities that you might want to do while you're laid up for the first week or two. While you're stuck at home for the first week or two. Even if you get home and you feel terrible and you just don't do it, that's okay. But having them available would be really beneficial. Because maybe you love puzzles, maybe you love board games, maybe you play online euchre, whatever it is that you enjoy. Maybe you decide this is going to be your opportunity to start a blog, to write a book. One of my favorite recommendations, especially the way technology is now, is to create a journal, not just for you, but for people who are going to have the same procedure that you're living through right now. Journal your day-to-day experiences. Journal the challenges, the wins and the losses, the frustrations and the excitements. Put it down into a Word document, a Google document, some sort of document, and then turn it into a book that you can actually publish and sell on Amazon. It's a phenomenal opportunity for you to share these things with people who are going to be in your shoes while turning it into a side income. So guys, just lots of opportunities out there. Now let's get into stairs. So stairs climbing, it's okay to climb stairs without assistance if you're able to, if you're feeling alert and oriented, not confused. However, you may need help. One of the most common strategies we use is we recommend having a walker on the ground floor and then having a walker at the top floor. So you're not bringing your walker with you. You have two walkers. Walkers are not that not that expensive any longer. And so if you live in a bi-level home, it will be safe mechanically the knee can handle you going up and down stairs, and your therapist should have shown you how to go up and down stairs safely. But it's just a nice benefit to have a downstairs walker and an upstairs walker, so you don't have to travel with it. Having somebody with you is great. There's lots of different strategies for negotiating stairs, from sitting on the stairs and going up one step at a time on your bottom, to going up with the good, down with the bad. That's a common phrase you're going to hear, to even using your hands to bear crawl up the stairs. I've seen all of these strategies be effective and safe. Your safety is priority number one. And then, of course, stuff like laundry, right? Cleaning. You see below, mail, meals. Like, these are things that you want to have set up before surgery. Create a list, again, of everything that you do in a day, right? If you're the person responsible for washing clothes, put that on a list. Figure out who's going to do it while you're kind of out of order. If you can go a week without washing clothes, line up your clothes day to day, so that if you do have spillage, if you do have seepage from the wound, if something goes wrong, you know, and you need to change your clothing, you have backups for each day. The more prepared you are, the more things are set up, the more peace of mind, and the better the recovery experience. So driving, most of you will not be allowed to drive following surgery. Some surgeons require 6 weeks before they allow you to drive. Some will allow you to drive based on your ability to, you know, if you're not on pain meds, you're not confused, if you're feeling confident, depending on if it's your right leg or your left leg that had the surgery and where you live in the world. These are factors that you want to discuss with your surgeon ahead of time. Again, a physical therapist or an occupational therapist can help you with driver safety and returning to driving, to make sure that you don't put yourself in danger or anyone else in your community. In the next video, we're going to talk about some of the equipment that you might use. Certainly the walker, the cane, the crutches, some of those things. So guys, as always, if you have questions as we progress through these modules, post your questions below, post your questions in the comments, and that will help me bring additional supplemental videos to you to answer those questions. We're getting through it, guys. You're doing an awesome job. Take a break, kind of let your brain digest the information that we've covered, get a little snack, get a little drink, and I'll meet you back in the next video.